Good morning. I'm Barbara. I'm 48 years old and I'm a French citizen living in Sweden. I have just finished my chemotherapy for breast cancer. I finished on Monday, but I was diagnosed in early February this year in 2021 with ductal carcinoma in situ cancer. It turned out that I had 3 tumors, and my diagnosis followed a mammogram and a biopsy. I have to say it did not really come as a surprise. I had detected a change on my breast in November 2020, but as I was very deeply involved in the COVID-19 crisis team at my work, I pushed on the side the signs. I also knew that I was going to have an annual medical check coming up in January 2021, and I would take it up with the doctor. My first thought when I was diagnosed were for, of course, my family and my children. I have 2 girls, 12 and 8 at the time of diagnosis, now 13 and 9. And the question that came to my mind was like, how bad is it? Will I die? When will I die? We all know people having cancer and living with cancer, but we tend to remember only the worst case scenario, the worst stories. So that is my first thought. And then came, how will I tell them? How will I tell my children? And how will that impact on them, on their lives? How much will it affect me from being a normal mom and for my husband, a normal partner? But somehow it never came into my mind not to tell my children. The next thought were about my family in France, my mom and my sister, because I'm living as an expat in Sweden. And at the time, due to the COVID situation, France was under lockdown, quite strict, and curfew, traveling was difficult. And I decided that, no, I cannot tell them. I can't worry them now. And my mom is dealing with, or was at the time dealing also with loneliness, being a widow, and she has a health issue, including depression. So this news would have really pushed her over the edge. I needed to protect her and protect myself, because I thought that I could not deal with her sadness and mine and my worries and hers. So I decided not to tell them, with the help of my husband, of course, who didn't really agree with my decision, but respected it. And my children, which I had to ask to lie to their granny, but they didn't want granny to cry. Then I have to say that came the thoughts about my job, because since February 2020, I was dealing with COVID-19 response at the European level. And I could see already in a year that the constant pressure, the huge amount of work, long hours, short deadlines, all that had taken a toll on the team at work, and I will have to quit the team. It was very hard because I felt, okay, I was going to let them down, let my colleagues down when they needed it the most at the time where public health needed it the most. And as a professional and public health professional, it was really, really hard. So the impact of the diagnosis was quite difficult and hard, both as a mom, as a partner, as a professional, as simply a human being. And it took another big impact on me, because the last couple of years, to try to fight stress and to find a balance between career, family, and my own time, I had been training, and I found my joy in running. And I'm lucky enough to live close by a very beautiful natural reserve with nice trails. So I taken on trail running. So, and I have to tell also, in 2020, I also sustained a knee injury that I had just recovered from, and I had resumed my training and running. So was this breast cancer diagnosis take this away from me too? And when you meet the medical team, their job is to inform you and to prepare you about all possible scenarios, explaining all possible side effects and what is available to prevent and reduce them. They prepare you for the worst, still reassuring you, because this is needed, as no one can predict how one tolerates the treatment. But it left me wondering, how diminished will I be? How much, what defines me as a mom, a partner, a professional, a sportsman or sportswoman, and a human being will I lose? So how can I, me as a person, prevent feeling diminished? How can I prevent the side effects? How can I do to prevent all of this? How active can I be? Will I be able to train? And mostly, can I continue to run? Were all those questions that I ask myself. And I wonder what will be the impact on my life, not only after treatment, but during treatment. What did I do as complementary therapy along my clinical cancer care, and how it helped me? Well, when your body change, your appearance change, it is actually very, very difficult. It's difficult as a woman, especially when you go through breast cancer. You will get surgery, your body will change, you will get through chemotherapy, you will lose your hair, you will look different. So I've been very fortunate to stumble upon Look Good, Feel Better, very good foundation, and I found it within Sweden, and I realized that they were offering a workshop, a makeup workshop. And although I wear makeup, I don't wear so much makeup. But now I was looking for how can I learn to not look sick, because that is very important. Was with my change of appearance, I did not want to look sick. I didn't want to look sick for my children. I didn't want to look sick for my colleagues, and I didn't want to look sick in general. So I got very lucky to be able to participate to one of the workshops from Look Good, Feel Better. And because of the COVID situation, all the face-to-face workshops were cancelled. And I'm very grateful that the foundation could adapt to the circumstances and actually propose the workshop online. I was even more happy when I got delivered in the morning of the workshop a little goodie bag with all the beauty products. And I took part of this workshop. It was wonderful to actually do the workshop with all these other women that were in the same situation than me, and we were all at different stages. And so those workshops were very, very important. And I have to say that I learned how to put foundation for the first time in my life. So that was great. I also, through Look Good and Feel Better, took part of meditation course, also online. So I have to say that maybe we could thank COVID for putting much more courses available online and allowing cancer patients going through chemotherapy to actually take a lot of complementary therapies and courses online without having to fear the risk of increased infection. Otherwise, what was very, very important for me, as I said before, was running. The diagnosis had really impacted me in the way that will I still be able to train and run, which really I enjoyed. When I was talking to my oncologist, she was extremely positive and really encouraged me, saying that nothing was off limit for me in terms of training and running. The only exception was for swimming and taking saunas, and that is because I live in Sweden, due to the risk of infection through the PICC line. And she actually told me that in Sweden, the recommendation for a cancer patient undergoing chemotherapy was that they should exercise a minimum of 30 minutes every day with a higher pulse. So she really encouraged me to train and to train any type of training, whether it was cardio, stretching, bodybuilding, body strengthening. But what I found out is that there are actually no structures really for patient undergoing chemo. There's only few programs for cancer patient undergoing their rehabilitation after treatment, or for patient living with a spread cancer or secondary cancer. So, as I said, the COVID situation has made it both harder and easier. Harder because training indoors became out of question due to the risk of infection, but easier because many courses went online. Living in Sweden, I was actually lucky enough, and especially living in the capital in Stockholm, that there are many outdoors gyms, which allowed me to continue to do bodybuilding and body strengthening in a very safe environment. I actually continued to do my Pilates course because it went online. I first spoke to my trainer explaining my situation, and because she knew me, she allowed me to join the online classes. I have to say, online classes are great because you don't have to deal with the stare of others, whether it's real or not, whether it is a real stare from people looking at you, wondering what you have, or just thinking that people are looking at you because you're yourself self-conscious about how you look differently. So with the online course, you're just one participant like any other. What I also took on was I always been biking in Stockholm because the city has the infrastructure and it's quite generous with cycling path. And during the COVID situation, public transport became a higher risk. So I increased my biking more and more. I decided that, okay, I will bike everywhere. And I bike to take my children to school, but I also bike to my oncologist appointment. It was a way to say, if I can bike, if I can train, I have control. And this was the only control I have, was to actually decide how much or how little I would do every day. And finally, I decided that I will run no matter what, whether it would be 1 kilometer or 10 kilometers. And I've been looking for testimonies, and I found quite a lot of testimonies of runners going through chemo. And I also read a few books about running and training through chemo. I read scientific literature about the benefit of sports before, during, and after cancer and chemo. So for me, it was a no-brainer. I put my trainers on and I ran. And I started to run 10 days post-op. And I got 2 surgeries. And both times I put my trainers on and I took control. I took control of my cancer. I took control of myself. I put on 2 bras and I ran. And then I continue to run 2-3 times a week, listening to my body, figuring out which days were good and which days were bad days. And I have to say that the most important, the last 5 months for me, was to actually exercise every day, cycling, walking, taking the stairs, doing Pilates, bodybuilding, body strengthening, stretching, running. I did it all because my motto became, no matter the distance, no matter the time, only the steps and only the sweat matters. And I've been supported by my medical team, whether it was my oncologist or the nurse that gave me my chemo every week, who said to me the first time, you know what? You can decide yourself when you're not feeling good to stay in bed, but going out will not make you feel worse. So it's up to you to decide what you want to do. And she was right. I got up every day and I went and did something. And it was the best advice and the best thing I've ever done to exercise every day. And what I have to say, what I really, really missed in this exercise, it's the company, because most of the activity I did it alone. I missed the camaraderie of sharing the same passion for sports. So being in a gym with other people, being in a running club or a running group with other people. And I have shared my experience through a forum of women undergoing chemo. We all started the same month, and I shared with them my training schedule, and I was very surprised that I got a lot of praise for it. I've been asked a lot of questions because I realized that maybe not every country or every medical ward is actually promoting exercise and sport when you're undergoing chemo. And women, when this happens to us, we lose certain confidence. And what I really would like to say is, for me personally, exercising and training every day for a minimum of 30 minutes with a higher pulse has been the best I could do. And I avoided quite a lot of the bad side effects. And now 5 months down the line, I'm happy I did. I'm really happy. And I'm happy if I can inspire other women to actually put on their trainers and go and train regardless of going through chemo. I would like to inspire health providers and professionals to reach out to women undergoing chemo, not being afraid of asking them to join and exercise, because we're not made out of sugar. We are strong. We are strong, and exercising makes us stronger, both mentally and physically. So that was my message, and I hope that it has convinced you that we actually are capable of more than we think ourselves, and that just give us the confidence to train. Thank you.